Well, I'm the Chief Executive Officer of the Mental Health Association of Essex and Morris Incorporated, which is in North Jersey, just west of Manhattan. And we actually have 3 involuntary outpatient commitment programs. We call them assisted outpatient treatment programs. We have 3, one in Essex County, one in Morris County, and one in Sussex County. And that's interesting because Essex County is more of an urban county. Morris County is a suburban county. And believe it or not, there are rural areas in New Jersey, and Sussex County is a rural county. So we have 3 programs in really 3 different geographical areas and 3 distinct populations and demographics. The one thing we found in all 3 counties, in terms of setting up an AOT program, you need 3 essential elements. You need to collaborate, you need to collaborate, and you need to collaborate. And then I guess the 4th element would be to educate. So in setting up the programs, we did a lot of groundwork in regards to reaching out to the courts, reaching out to the specific judges that were assigned, reaching out to the treatment providers, the hospitals, the mental health centers, and then just as importantly, recruiting the right psychiatrist who could also collaborate. Because really for AOT to be successful, the relationship between the judge and the psychiatrist is essential. They have to speak the same language and they have to have the same goals. Also, it was important in all 3 counties in our experience to collaborate with the patients, the consumers, and educate them as to what the process was about. And to the extent that family was available, it was also very important to communicate and collaborate with the family. And as a result of that, if you put that team in place, the psychiatrist, the judge, the consumer, the family members, as well as our programs who through case management acted as the monitor, if you put that team in place, we found that the programs were set up appropriately. And then furthermore, we got good outcome measures. We saw that hospitalizations went down, the incidence of violence went down, incarcerations went down, arrests went down, and treatment adherence improved dramatically. Well, the Mental Health Authority in New Jersey is the state government out of Trenton. New Jersey is a very densely populated state with 9 million people, but it's not a very large state. So everything in terms of policy emanates from Trenton. So initially, going back 8 or 9 years when we first implemented the AOT programs, the Mental Health Authority was actually opposed to it. And they were overruled by the legislature and the governor's office. And we had to advocate with the legislature and the governor's office to sign it into law and basically overrule the Mental Health Authority. So we had some relationship building to do. And in doing that, we also found that we really did need their support and we needed their ongoing communication, because they do have a role in oversight, as they should. You know, they need to hold us accountable. And also they provide the funding. You know, if they don't continue to provide the funding, you know, we could have the greatest mission in the world, but if we don't have the margin, we can't provide the service. So working with the Mental Health Authority is very important, regardless of what their original position may have been. Well, in New Jersey, our Essex County program was actually the first AOT program in the state. And frankly, a lot of the psychiatrists were afraid of it. They didn't want to be the first person to do an outpatient order. So, you know, that was vexing at first. It took a lot of education, a lot of cooperation. In terms of treatment non-adherence, I would say about 50% of the consumers really respond to the black robe effect. Most of us are law-abiding citizens that have respect for the courts, and individuals with severe and persistent mental illness are no different. So basically the judge would say, hey, you know, Lou, you need to work with Dr. Brown and develop a treatment plan and follow it. And we always found that about, and still find, 50% of our consumers just respond and they naturally participate. I would say the other 30%, they really need the case management that we provide to encourage them to comply with the court order and give them every opportunity. In regards to that 10 or 20% who are treatment, who don't follow the plan, basically that's where communication is very important. Communicating with their families, communicating with the court, bringing them back, not under the court order, but bringing them back before the judge, who can encourage them to participate in treatment. And then once in a blue moon, we would write what was known as a transport order. If someone was treatment non-adherent to the point that they began to decompensate. Once in a blue moon, we write a transport order, which transports them to an inpatient facility for further evaluation. And then more times than not, they meet the inpatient standard and they're hospitalized. What's more vexing, and it's on rare occasion, because AOT works, but on rare occasion we do have a consumer who follows the treatment plan, does everything they're supposed to do, and because of the course of the illness, they decompensate anyway. Schizophrenia and mental illnesses are no different than any other biologically based illness. Once in a while, despite our best efforts and despite the consumer's best effort, it doesn't work out. And when that happens, you need to be there for them and make sure that they get the inpatient care that they need. Well, I talked about the collaboration. The other equally important part is educating the system, educating the mental health system, educating the hospitals, and to a certain extent educating the courts as to exactly what AOT is and how it works. And when I say the courts, it's not just the judge. The public defender is very important. The prosecutor's office is very important. And the clerk is very important. The civilian who actually coordinates all the paperwork. If you don't have the support of the clerk, you may as well spit in the wind just to prove it's going to hit you. You need that type of bureaucratic support. The key to success there is understanding their culture, understanding their language. Unlike the mental health system, where the court system says be there at 10 a.m., they mean 10 a.m. If the judge issues a directive, it's not a suggestion, it's a directive. More so for the providers. A lot of the providers didn't realize that when the judge issued the order that they had skin in the game too, and they had a responsibility to the court and to the patient. And that was news to some of the providers, but we were happy to educate them about that. The main lesson that we've learned is to never give up. We have found that if you stay involved with the consumer and with their family and with their court and with their treatment providers, eventually it'll work out and the consumer will get the treatment that they need. Oftentimes that's in an outpatient setting. Sometimes that's in an inpatient setting because that's just what's needed in regards to the course of their illness. But then we find that a month or 2 months later, when they're discharged from the inpatient unit, we pick them up again. And you just never give up because they're human beings. And as long as they're breathing, there's always hope. I had some sense of it, but the providers were more resistant to it than I initially anticipated. And I wish I had known that before. I would have been better prepared for it, and I wouldn't have assumed a certain competence that wasn't there. I just feel strongly that AOT, for that small subset of individuals that are so impaired by mental illness and don't realize that they're sick, and as a result of that don't participate in treatment, and then as a result of that, become a danger, usually to themselves, occasionally to others, usually their families. I think for that small subset of individuals, this program is life-saving. It's life-saving and it's life-enhancing. And I just feel strongly that morally it's the right thing to do, because we just can't ignore these people.